everybody. It's Dr. Torres from Skin Skinnier. We're in La Jolla, California, just a little suburb of San Diego right by the ocean. And we specialize in skinny BBLs. We also specialize in awake skinny BBLs. So what is a skinny BBL? It's anywhere from a BMI of 19 to 24. That's a skinny BBL. From 24 to 28 is a regular, BBL. I cut off at 28. Why? Well, because it's really, if you want to do this procedure and be awake, you have to have a smaller BMI. Anything over 28 is difficult to really numb up properly. The other thing is, this is our liposuction machine that we use. It's a molar machine out of Germany, and it's also known as tickle liposuction. Basically power assisted, it just vibrates. It doesn't use ultrasound, it doesn't use laser, it doesn't burn you or cook you or anything like that from the inside. It's not really necessary to do any of that. Nitrous oxide, this is something that we use during the procedure and allows you to be awake, and we also use other medications, but you really are fully awake, and halfway through the procedure you'll get up, go to the bathroom, empty your bladder, come back, I'll redraw on you. It is cooperation. I roll you around kind of like on a rotisserie, and that's how we do the whole sculpting thing. It's teamwork, okay? It's you cooperating and me cooperating. We work together to pull off what we pull off here. We use really soft, tiny cannulas. This is a 3mm Mercedes cannula. This is a very common cannula for liposuction. It's very delicate, and on the end here is a suction port, and so when I slide this back and forth, it sucks fat into this little space, and it just kind of brings it into the cannula, and we collect it into a sterile canister. Our sterile system is completely closed. It's not open to the environment. So we harvest fat in a sterile container, and then we reverse the pump when we're ready to re-inject it. It doesn't see the air or atmospheric air or anything like that. So it's completely sterile and closed. All right. The other thing is this a doable procedure, like being awake? And one of the biggest questions that I get is, is this a painful procedure? Well, it's not painless. It's 98% painless after I'm done numbing you up. So I need 30 minutes to get you numb, and I will make you very, very numb at the very end of that 30 minutes, okay? The rest of the procedure is liposuction and a BBL, and that is completely doable. You will be 98% numb. It is mind over matter. Really, you're just laying there, and you might feel vibration, you might feel a pinch or a burn that's very brief and mild, and that's it. The whole 2 hours, okay? Because in order for me to do a good job, you got to lay there and be really comfortable. If you're fidgeting and you're in pain and I sense that you're suffering, it's hard to do a good job. So I do everything I can to make you as numb as possible.